International collaboration in the research of frontotemporal dementia is very important. Even the frontotemporal dementia is not as rare as we used to think before. There's a great clinical, neuropathological and genetic variability inside the spectrum of frontotemporal lobar degeneration. For example, in our cohort of patients suffering from frontotemporal dementia, we have more than 200 patients, but only a part of them are suffering from, for example, of behavioral variant frontotemporal dementia. And of those patients, only a part are carrying specific mutation, for example, C9orf72. So if we want to make research on specific clinical phenotype or in specific genetic mutation, we have to combine our cohorts to have enough reliability and validity in our research. In addition, it's very important that we can share our knowledge, for example, in methodology. So the speed of the discovery of mysteries behind frontotemporal dementia is increased. Also, international collaboration gives us a chance to specialize in some methods or some specific projects in the research of frontotemporal dementia. For example, every group doesn't have to concentrate on neuroimaging or specific biomarker studies. Yes, there are actually quite a lot of differences between patients suffering from frontotemporal dementia in Italy and in Finland. Most of all, the genetic background is quite different. Here in Italy, I think granulin mutation is quite common, but in Finland we don't have practically at all MAPT or granulin mutations. The major genetic cause for frontotemporal dementia in Finland is C9orf72 repeat expansion, and this specific mutation is associated with a wide spectrum of neuropsychiatric symptoms. And it's also practically the only genetic cause that causes simultaneous motor neuron disease and frontotemporal dementia. Because of the great amount of neuropsychiatric symptoms associated with this specific mutation, in Finland patients are quite often treated in psychiatric institutions for 5-6 years before the discovery of the neurodegenerative disease behind their symptoms. In addition, there's a great need to evaluate very carefully patients with late onset psychiatric symptoms if there is possibility of chance of frontotemporal dementia. I think at the moment there is a need of international collaboration between medical experts, but also patient organizations and in addition to the research community. At the moment there is no enough information of the frontotemporal dementia in the mother tongue of families and patients. And I think that quite often there's a great possibility to relieve the worrying of patients and families and confusion of families with adequate information of the disease and of the symptoms. And I think that international collaboration between patient organizations and medical professionals could provide more adequate and frequently updated information for families and for patients of this disease and how to manage with the disease. I think it's very important. Even when we didn't have as much patients suffering from COVID as here in Italy, there was kind of lockdown. People weren't allowed to go outside only for short walk or for grocery store. And also in the hospital, if there wasn't urgent need to go face to face to the hospital, it wasn't possible to make normal appointments. And thus we had to make quite a lot, change our way of thinking. So we had appointments by calling, telephone calls and with video connection. And I think we have learned quite nicely how to use those. But anyway, we didn't have possibility to make physical examination as normally. And I think the communication also face-to-face is very important. So luckily now we are again having a possibility for normal appointments, but no one knows what is coming in the fall. I think that quite often the diagnosis is at some point a relief because the symptoms are quite, the spectrum of symptoms is quite large, and these symptoms are making confusion for patients, but most of all for the families. And quite often the correct diagnosis after years of families suffering from the situation is relief. And there is a great need of information what is the disease and what symptoms are associated with this. So I think it's really for the families. We have Finnish National Memory Organization, which is organization for all dementing diseases. But I think it's more for patients and families with Alzheimer's, and especially we are lacking organization for working age people with dementia. I'm expecting to learn new methods and of course to increase the collaboration between our groups in Italy and Finland. But also I think very important is to learn the way people are working here. So I think it's also very important.